Okay, so my name is Meredith Kwok. I am the Associate Director of Alumni Relations, and thank you for joining us for the first episode of our faculty Fireside Chats. As you may already know, the new UCI School of Pharmacy and Pharmaceutical Sciences was established on July 30th with the UCI region's approval of the Department of Clinical Pharmacy Practice. That is a mouthful, but it is still exciting to say because it's still very new news. This department is led by founding chair, Dr. Alex Chan, now has 9 faculty members and is accepting student applications for the fall of 2021. So whether you are a faculty, staff, alum, student, or a friend of UCI, I hope you will join us in recognizing and in celebrating this exciting time of growth for our school and the UCI Samueli College of Health Sciences. So before I introduce our guest this afternoon, one small housekeeping note: this conversation will be conducted interview style. So please feel free to enter any questions you may have throughout the conversation into the Q&A feature, not the chat, the Q&A. And this will also be recorded for future viewing and listening purposes. So without further ado, I would like to introduce our very first guest. Thank you for being our guinea pig, Dr. Keri Hurley Kim. Dr. Hurley has been a pharmacy educator since 2014. She has worked with PharmD students and residents at all levels of didactic and clinical education. Her academic areas of interest are ambulatory care-based topics such as immunization, asthma, COPD, HIV, and self-care. Additionally, Dr. Hurley has taught public health-related courses for pharmacy students. So Dr. Hurley, thank you for being with us. Welcome to the team and welcome to the Anteater family. You're one of us now.
Thank you so much for having me and for hosting this webinar, opportunity to get our name out there a little bit. I've been really excited to join UCI and get to know all the different resources and colleagues and really everything that's available to help support the School of Pharmacy and Pharmaceutical Sciences.
Wonderful, thank you. We're glad you're here. So just to get started, can you share with us a brief history of your education and your career path before joining UCI?
Sure, yeah. So I've gone through my entire educational journey at very small universities. So I finished my undergrad work at Sonoma State and then went on to Touro University, which is in the Bay Area here in California, for my Doctor of Pharmacy and Master of Public Health degrees. I then completed a 1-year residency at Western University with a focus in both community pharmacy and ambulatory care. So this is where I started to develop some of my experience in travel health and immunizations. Right now, I'm a board certified ambulatory care pharmacist and also have the certificate in travel health from the International Society of Travel Medicine. I recently joined UCI from another small school of pharmacy called West Coast University, and I have a practice site at a federally qualified health center here in Los Angeles called the Saban Community Clinic.
Wow, impressive. I have a few questions formulating on your travel certification, but we'll leave those towards the end. So we'll jump right in. Why UCI? I mean, you're here just at this exciting time as we're a brand new school. Why UCI? Why now?
Yeah, so this is a good question and one that we get asked a lot in our department. And I think the kind of best answer that I've been able to boil down for this question is that there are a lot of changes, not only in the pharmacy profession, but also in healthcare. So right now we are slowly shifting more towards a focus on value-based care, where we are assessing providers based on the outcomes of their patients, not just how many services did you provide, how many patients did you see, how many tests did you order, things like that. And I think UCI is really well positioned to train exceptional pharmacists who can contribute to this value-based system. We are growing our PharmD program out of an existing pharmaceutical sciences program, which is really unique. So most pharmacy schools, if they are built from new, they are conceived as a doctor of pharmacy program, And then some pharmaceutical sciences faculty are kind of added into the mix along the way. But I think we are really intentionally building this PharmD program on our already strong pharmaceutical sciences foundation. Another really important aspect that UCI is able to offer is interprofessional training. So we have an academic medical center that not only includes, will include opportunities for training pharmacists in the inpatient setting, but also in the outpatient and ambulatory care setting. So the federally qualified health center that is affiliated with UCI is another, really great opportunity that students will have to be able to train for, the kind of practice models that I think are really those of the future. I think, and another thing that we also really like to mention is that UCI is the #1 feeder school for all of the pharmacy schools in the US. So it really only makes sense that we, retain and train some of those pharmacists ourselves.
And I agree that it's very exciting that we do have this great foundation of undergraduate students. And as I'm getting to know our alumni population, I mentioned to you before, so many have said to me that even though they've gone through our PharmD program, they are so excited about this news. And they said that, if this program was available for me when I graduated as an undergrad, no questions asked would I have stayed on at UCI. So that goes to speak to, as you said, this program that we already have, and then the future. We have a very robust undergrad program.
Absolutely.
So tell us a little bit about your research. What research have you worked on? What are you bringing here currently now to UCI?
Sure. So historically, my research has really focused on pharmacy practice models and pharmacist scope of practice. So looking at different states and what are pharmacists legally able to do. So all of the pharmacy practice laws in the US are state-based. So what I can do as a pharmacist here in California might be really different than even our neighboring states of, Oregon and Nevada, really different from New York and other places. So looking at, what are pharmacists able to do and what is the variability. The biggest project that I'm working on right now is we have started a clinical service at my practice site where we are helping the physicians, nurse practitioners, physician assistants to respond to their refill requests. So if you think about kind of the life cycle of a prescription, the pharmacy fills it, they may refill it one or more times, but eventually those refills run out, right? So the next step would be for the pharmacy then to ask the physician or the other prescriber, should we continue to refill this, or do changes need to be made? Does it need to be stopped? Things like that. So physicians have to spend a lot of time reviewing and responding to these requests, to the point that it really does often reduce the number of hours that they're able to spend seeing patients. So pharmacists are now starting to get involved with that process. So not only can we help to reduce some of the workload and the time burden for the physicians, but we can also use that service to give review of, the patient's entire medication list, the appropriateness of those specific medications with regards to their other diagnoses, with regards to the other medications that they're on, and give, not just to say, yes, refill it, or no, don't refill it, but we can give a lot of information to the physicians in the form of recommendations and interventions. So the research project that I'm working on is looking to see, what is the effect of this service. So first and foremost, do the providers like that we're doing this? Is it actually saving them time? Do they feel that there is a value in it for them? And then also, is it having an impact on patient outcomes? And eventually we'll be able to look at economic outcomes as well.
That's fascinating, and definitely something great to offer our new students insight on. Now, tell me, where does your passion for this field come from? Going back a little bit in your history.
For pharmacy in general?
Yes.
Or, yeah. So I knew I wanted to be a pharmacist from, a couple years into my undergrad work. And I got a job as a, what we call a pharmacy ancillary, or a clerk at what was then called Long's Drugs, now have been taken over by CVS, and had the opportunity to work with some really great pharmacists who, didn't just take the time to teach me how to do the work at hand, but, gave me some insight into, different things that pharmacists are able to do. So it really started there. And then, of course, during my time in pharmacy school, that just grew with being able to, experience those things and, learn that being a pharmacist doesn't just mean filling prescriptions and making sure that they're filled correctly, but being able to actually, make interventions and educate patients and follow up with physicians when things are not, the way that they should be based on our evidence-based guidelines, things like that.
And going off script a little bit, but so where did this passion for the travel health filter into your career path and your journey? Because that's very specific.
Yeah, so travel health is, just, for anybody who's not real familiar. So travel health essentially addresses patients who are traveling internationally, and we're able to give them, vaccines, medications to, for the most part, we're looking at preventative services. So, if you're going to Africa versus the Amazon in South America, there are lots of different risks with regards mostly to infectious diseases. So we work a lot with routine and also some specialty vaccines, anti-malarial medications, things like that. And during my residency, a lot of the clinical training was in 2 different pharmacies that both offered this service. I think it's a really great service for pharmacists to get involved with because there's a lot of opportunity, first of all. So most patients who do travel don't actually have a pre-travel consultation. And pharmacists are really well positioned to be that kind of frontline provider where, typically we would ask for an appointment, but it's much easier to get an appointment with your neighborhood pharmacist as compared to a primary care physician in most cases. We also know that, most physicians are not very familiar with some of these more specialized vaccines and, which anti-malarials are appropriate for travel to which parts of the world, things like that. So with a little bit of additional training, I think it is a big gap, but one that pharmacists can really contribute to filling.
Absolutely. Is this something you would recommend to all people traveling? I know traveling has sort of shifted in the last few months with us, but is this something that you have developed in your personal life, just that extra step of care and preventative health before you get on a plane and leave the country?
Yeah, absolutely. So what I usually tell patients is, unless you're traveling to Western Europe, some of the, highly developed countries in East Asia, you should definitely talk to someone. So the amount of intervention that we're going to give, somebody traveling to Thailand versus somebody who's traveling to Angola is going to be really different. But there are risks, in, most areas of the world, especially those that are, tropical, those that are economically developing. And it is never a bad idea to just ask, is there a vaccine I need? Am I at risk for malaria? Can I take antibiotics with me in case I develop traveler's diarrhea? So there are, a lot of little things that probably we don't think about until it's a problem.
So something we'll keep in mind for when we're all getting on planes and
travel health is definitely is slowly picking back up, but most of the colleagues that I have working in that field, primarily things ground to a halt very quickly in March.
Well, we will get back there eventually, but pharmaceuticals, vaccines, public health, these have all become sort of dinner table conversation topics that never were before. So this is maybe a simple or a complex question, but what is most exciting about this field that you're in right now?
I think the thing that's most exciting for me is something that's, it's been going on in some form or another for a long time, but it's this shift away from pharmacy being a product-based profession where we are, providing, dispensing prescriptions more to a cognitive profession. So in my practice currently, I don't touch medications. A lot of pharmacists that I know, their practice does not involve counting pills. It does not involve dispensing medications. And I think that's a really important distinction that a lot of the public doesn't necessarily understand about pharmacists, is that we don't all dispense medication. And that's something that it's not brand new in 2020. It's not even brand new since I've been out of school. But I think as we shift more towards this value-based healthcare system, we're going to need to expand our scope of practice, shift into some of those practice models that allow for pharmacists to have an increased presence in medical practices. So pharmacists are, really prevalent, obviously, in outpatient pharmacies, and there are a lot of pharmacists who work in hospitals. But I think that ambulatory care, primary care, medical practice-based pharmacy model is really where we will be able to expand in the future. So there's lots of research that has shown the value pharmacists can bring into a medical practice, whether that's by the pharmacist seeing individual patients, managing complex disease states. So a lot of what I do is managing diabetic patients that need a lot of individualized attention that a physician just is not in a position to be able to offer. My pediatrician's office has its own pharmacist who consults on everything from, dosing to, more complicated medication regimens for pediatric patients. So I think this is really where the most exciting opportunities for expansion and increased involvement for pharmacists is right now.
And that's such a great message for our younger students, prospective students, high schoolers, when they're looking out on all of those vast number of possibilities of what will I be when I grow up, to know that there are so many options. So the $1 million question is, how do we educate young professionals, young students, young women that this is available for them and that this field has changed? You don't have to have the answer to that. I know it's a hard one.
I definitely do not have the full answer, but I think a good place to start is just by having these things available as learning opportunities while they're students. So I think, again, UCI has a really unique opportunity here because we do have connections with multiple primary care, outpatient medical practice type of settings. We will also have the possibility for students to do some of their rotations at, non-UCI sites, like the clinic that I work at, where they'll be able to actually, see not just what are we doing today, but also, the opportunities for different things that we can, potentially contribute in the future.
Right. So what would you change other than this messaging? Is there something in the field that you would like to see in 5 years, 10 years being done differently?
I think the biggest thing that I would like to see different is for there to be more recognition of the value and the hard work that, my colleagues in community pharmacies are doing. I think a lot of times in academia and in clinical pharmacy, we think of, the clinical pharmacist, and then everybody else is just a community pharmacist, or they ended up in community pharmacy because they couldn't get into a residency or something like that. But I think there truly are a lot of excellent pharmacists working at, independent pharmacies, at corporate pharmacies, things like that. But they don't get the recognition, not only from the public, but in a lot of cases from their own employers. And I think that's something that's really unfortunate. A lot of times their time, their input, their work is not valued beyond how many prescriptions did you dispense? How much money did your pharmacy bring in? So there's very little focus on, did you do the right thing for the patient, even if that meant spending extra time counseling or not dispensing that prescription. So I think allowing that value-based thinking to kind of permeate more into community pharmacy is something I would like to see changed. Unfortunately, because it is a very, money-driven sector, I think it is going to be difficult. But if I were to choose one thing, that would be.
Well, UCI obviously recognizes that there is a need for us to expand and offer these opportunities in our communities. So I think the future is bright. Thank you for your honesty on that question. So what are you excited about being a part of this brand new school and educating our very first class in 2021?
Yeah, so there, I mean, I think there's a lot of different things to be excited about. Just kind of selfishly and personally, I'm really excited to get to work with a lot of new colleagues, to expand my involvement in research and, you know, to get to know all of the different things that, you know, go on at UCI. But in terms of, you know, what am I excited for our students, I think just being able to be part of building this school that will educate future pharmacists in a really intentional way, that they will be ready for, you know, entering some of these more kind of novel models of practice, I think is probably the most exciting thing, that we're able to think about, you know, where is pharmacy going to be in 5 years, in 10 years? Let's educate students for that, rather than let's ask CVS what they want in their pharmacists.
Well, thank you. Please, of those that you have joined us, thank you for being here. Please enter any last minute questions you may have. I have one. Tell us about yourself outside of your profession. Just a few things to get to know you as a person.
Sure, yeah. So I actually am one of those, I don't know if you would call it brave or maybe misinformed people who will be continuing to live in Los Angeles and commuting to LA. So I do live in Koreatown in Los Angeles. I have a almost 2-year-old daughter and two cats at home. Probably my biggest hobby outside of work is running. Don't get to do that quite as much as I would like to right now, but yeah, I think those are pretty much the summary, if you will.
You think you'll still be living in Koreatown when you're driving to Irvine every day? We'll see how that goes.
Yeah, for the medium term, definitely. I could definitely see moving to Orange County at some point, maybe a year or two down the line. But yeah, we'll see what happens.
Well, we're so thrilled that you've decided to join us in Orange County at UCI. Like I said, the brand new UCI School of Pharmacy and Pharmaceutical Sciences is here. If you are a prospective student, in a follow-up email, we'll send a link if you're interested in applying for a fall 2021 class. Alum, there's so many ways to get involved and support the efforts like Dr. Hurley's and others. We have a raised hand here. You know what? This is an experiment. This is the first time we're doing this. I'm going to allow our audience member to speak here and see if this works, everybody, okay? Let's just roll with it. Hello? Hello? How about this?
Hello, can you hear me?
Yes, do you have a question for Dr. Hurley?
Yes, I have. I think I already emailed her, but then I want to give the direct questions. My son just graduated from high school this year, and he going to San Diego for engineering, chemical engineering and pharmacy. But we don't know that we have the program for school pharmacy over here. Now we know that. How can we move him back over here? What do you think? What's the best way to do? This is the first year in San Diego, right? UC San Diego.
So that question might actually be better directed to the undergrad admission. So myself being very new to UCI and only having contact with the graduate division and the School of Pharmacy, I don't think I'm the best person to give you information on that. But there's a lot of information on the website for undergrad and admissions to the pharmacy school eventually as well.
Yeah,
Like, can he still stay in UC San Diego to study for the first, second year and move over here, or should he move back over here? Now that's my question. Because we have a school for pharmacy over here, yeah.
I think, transferring is absolutely possible. And Dr. Hurley, if you don't have the answer for that, maybe, sir, we could get your email and we could connect you with one of our advisors that would have a better answer for you.
Yeah, thank you. Yeah.
Well, now we know we can have participants speak up and join us. So anyway, Dr. Hurley, thank you again. If you do have any last minute questions, feel free to add them in the chat. I'll make sure to get them to her. I am going to release a very short poll. This is an experiment. As I've said multiple times, we're trying new things. Our goal is really to just introduce this robust faculty that is now a part of our brand new school to our community, to get to know who they are, the research that they're bringing to us, and get excited for the first class in the fall. So we do have one more fireside chat lined up, October 27th, same place, same time, 12 noon. That's with Dr. Christine Cadiz. I can see she's here today. I'm cheerleading for you, Dr. Hurley. But please do help us fill out this poll and share any feedback that you have. We're hoping to really craft this in the best way possible. So thank you all for being with us. Any last thoughts, Dr. Hurley?
No, just thank you. This was really fun, really easy way to talk a little bit about pharmacy. So
we have a question that just came in. If we have one more minute, we're a little ahead of schedule. We'll go back a bit. Dr. Hurley, do you have any plans to incorporate integrative health into your practice? That is an excellent question, because we are now part of a College of Health Sciences that truly values integrative health and medicine.
Yeah, so I don't have any very specific plans for integrative medicine, but I will say that, I think one of the most important things that pharmacists can do is recognize when it is appropriate to give a medication and when it is not. So I don't think medications and prescriptions are the answer for every problem. I do, give referrals for patients to integrative practice. So the clinic where I work, we have an osteopathic physician who does, traditional Western medicine, but she also does acupuncture as part of her practice. So we do have, those things available to our patients. I am not as involved in that as, maybe I could be in the future, but it's something that I'm open to learning more about, and something that I think is exciting that UCI brings that in, because I think that there are definitely are cases and there are patients that we cannot fully address with the, kind of typical hospital-based Western medicine that we always think about.
Absolutely. Thank you. And thank you, Erin, for your question. So we snuck one more in there, but you're off the hook. You survived our first faculty fireside chat. Thank you so much for doing this with me. And again, if you enjoyed this, please share your feedback, and we will hopefully see you on October 27th. Dr. Hurley, thank you so much. Really appreciate your time.
Thanks for having me.
You're welcome.